thank you, first of all, for letting me come in and visit with you guys for a few minutes. I know you have a very busy schedule.
You didn't bring pain with you, did you?
No, I did not bring pain with me. Hopefully, though, I will bring an understanding and a strategy for how to deal with it. So, first of all, I just want to kind of introduce myself. My name is Reed, and I am a doctor of physical therapy. And over the last 3 or 4 years, I've been doing a lot of research in the literature and stuff like that, trying to figure out, gain a better understanding of what pain is, how do we deal with it more effectively. Without going into a lot of detail, a lot of personal reasons why I want to do that. And over the last year, I have spent in a specialized, I guess you call it a specialist certification training program, trying to even refine even more my understanding and ability to help people who are in pain. Okay, so let's just start off first of all by asking the question, what is pain? What do you guys got? Yeah?
Yeah.
Lower back pain, arthritis. Everybody's got pain, right? Nobody, very, very few people in this world get to go through life without any kind of pain at all. We rarely ever find ourselves in situations where we never have pain. So pain is a normal aspect of our life. It's normal, it's healthy. Generally, we could define it as an unpleasant sensory or emotional experience that we would typically associate with like either real, actual, or potential danger, right? That's kind of what pain is for the body from a physiological perspective. Its purpose is to alert us to danger. Now, some of the times the danger is real, and sometimes it's not. Sometimes it's just potential danger. So we're going to all do a little experiment real quick, okay? So take your hand, okay, fingers, I want you to pinch right here between your thumb and your index finger, okay? Now start off with a real light pinch, just a little bit of pressure. That doesn't hurt, does it? Okay. Yeah. Now pinch real hard. Does it hurt?
Mine does a little.
Yeah, a little bit of pain.
Swelling here.
Okay. If you pinch hard enough, you'll create a little bit of pain.
Shouldn't it?
Okay. Yeah. Now, was that pain real?
Not until we did. Well, it was when we.
Yeah. Once you experienced it, it was real, right? But it didn't cause any damage, right? So there was really no danger, no real danger, unless we kept pinching really, really hard. Eventually, maybe we might have been able to create some damage to the body. So our body created pain to alert us to the possibility of damage, the possibility of danger, right? There was no real danger, but we still had pain. That's the purpose of pain. You know, like, why do we experience pain? To protect us. That's the answer. It alerts us to things that might be dangerous to us. What kinds of things could be dangerous to us?
Well, like heat, fire.
Heat, fire, cold. Yep. Fire. A broken bone. Yeah, that might be dangerous to us. Some sort of injury. Yeah. Okay. What other things might be dangerous to us?
Internal bleeding.
Internal bleeding. What about emotional trauma? Does that ever generate pain?
Yeah, it could.
Yeah. What about depression or anxiety? Could those be dangerous to us?
Yes.
Could be.
Especially long term.
Especially if they get serious in their long term, right? Yeah, those things could generate pain. We don't normally think about that being something as generating pain, but it could, because it represents something that's dangerous to us. And that's what pain is. Think of it like an alarm bell, right? When our body is experiencing something that has the potential to be dangerous to us, it will alert us to that by sounding an alarm, right? And we experience that oftentimes as pain. It's not the only thing that our body can do to get our attention to let us know that there's something that might be dangerous, but it's a very, very frequent one that's used. Let's talk a little bit about how pain works. So it goes through a 3-step process, right? So let's just say, hypothetically, I'm walking down the road and I step on a nail.
Ouch.
Yeah, ouch. How'd I know I stepped on the nail?
Yeah, the pain. It comes in, it's quick, yeah, because I stepped on one.
But I didn't have eyeballs on the bottom of my feet, did I? So I didn't see that I stepped on the nail. I felt it, right? Right. So I stepped on the nail went into my foot, bam, right away. What tissue alerted me that I had stepped on a nail.
Something with nerves.
Bingo, nerves. Right, so the nerves in my feet generated a signal, went all the way to my brain in an instant. Faster than that. And so then what happens? What do you think?
Well, you're going to stop for one thing and look at it.
Yeah.
See, and not keep walking, you know.
Right.
So, and then...
I hope.
Get some doctoring, get some help.
Yeah, I hope I'm going to stop and look at it. Yeah, if I don't, it's probably the pain's going to get worse, right? Because I'm not dealing with it, right? Because that's the whole point of pain is to alert us to the fact that, hey, something's going on. It might be dangerous. You need to take care of it. Be careful, right? So signal comes in from my body. That's what's one step of the process, right? Then it hits the brain. Now the brain's the master control unit of the entire body. It controls everything. It controls heart rate, controls breathing, it controls all the movement that we do, everything that happens. But it's kind of like a man locked in a dark room, you know, no windows, no doors to get out. The only way this guy knows what's going on in the world outside of him is because somebody keeps slipping him messages under the door, okay? Well, he has to open up the message. He's got to read it. That's the input, right? That's the information coming in from the bottom of my foot saying something happened, right? But once he gets the message, he's got to do what?
Well, read it.
He's got to read it. Then he's got to what? Once he reads it, he's got to process. He's got to interpret it, right? He's got to make a decision. Is this good? Is this bad? What do I need to do about it? Right? What's happening in the brain when that signal comes in from the foot? Just an electrical impulse comes in and says, hey, dummy, you stepped on a nail. What you going to do about it? So the brain, it processes that information. It decides, oh, that's probably not good. That might be dangerous to me. Right? So then what it does is it sends and starts a process back down to the body. It actually creates the pain after it processes the information. How many people, raise your hand, have ever looked down one day and realized, wow, I'm bleeding.
Where'd they get that? Yeah.
I cut myself somewhere. Or you notice a bruise that you didn't realize where it came from. Right? Well, you created damage to your body when you did that, but it didn't register. You didn't notice it.
Yeah.
Now, I guarantee you that the nerves sent impulses to the brain, said, hey, you cut yourself, you dummy. Or you banged your elbow on that wall. What are you going to do about it? And the brain says, not worried about it. Got more important things to do right now. And that was the end. You didn't have any pain with it. So there's a decision that has to be made in the brain that says, good, bad, right? We already talked about the specific tissues that are involved in pain, right? We know that nerve tissue is always involved in pain, or else we don't experience it, right? If we didn't have any nerves, we wouldn't have any pain. Now, granted, we wouldn't have much of a life either, because we wouldn't be able to think, we wouldn't be able to feel, we wouldn't be able to move, we wouldn't be able to do anything else. But we wouldn't have any pain either, okay? But a lot of times we attribute pain to lots of other different types of tissues, don't we? Muscles, bones, ligaments, you know. We always assume the first time we experience pain that we've done something to hurt ourselves. And most of the time that's true. Most of the time that's true. But the cool thing about our body is that it heals. It's designed to heal. The body will heal. A lot of times in fairly predictable rates. And interesting thing is, like, a lot of times when people have injuries, their bodies will heal, but the pain will disappear long before the tissue itself has actually fully healed. Right? You sprain an ankle, after a couple days the pain for that sprained ankle is pretty much gone. But it takes multiple weeks before that injury is completely healed. That's normal. Yeah. But every once in a while we get a situation where the injury heals, but the pain never went away. Okay? It accounts for about 1 out of every 4 people who experience pain have this situation where the pain just doesn't go away. Okay? Long-term arthritis is an example of that. Okay? We've all heard about people who deal with chronic pain. Okay, and that's what that's talking about, that 1 in 4 case, a situation where the pain didn't go away in its normal healing time frame. Okay? So in that kind of a situation, okay, this is what we're talking about, so we're narrowing the scope just a little bit. We're talking about how the nervous system's role in those kinds of situations. All right, so on your little handout, if you'll take a look with me, you have this nice picture here, down here at the bottom. Okay? It's got a nice picture of the nervous system. Interesting fun facts, right? Did you know that the nervous system on the average person is about 45 miles long? Yeah, lots of nerves. 45 miles long, 400 plus nerves just from the neck down, okay? Millions of nerve connections, millions, trillions just in the brain, okay? So, under normal circumstances, you see this gap down here, right down here, it says where the, that little bumpy line right there, that represents the normal electrical signal that's going on in a nerve at any given moment, okay? Right? At any given moment, if you're alive, which thankfully you all are, right? Your nerves are buzzing. Okay, life is good. They're buzzing way down low. Okay, see how low that is on that graph? Now that dotted line right there at the top, that represents how far that buzzing line has to travel in order for it to send a signal to the brain. Okay? Now we're talking about specialized nerves, the ones that report danger to the brain. Our body's full of all kinds of nerves, and each kind of nerve represents a specific kind of information that it transports to the brain. But these report danger or potential danger, anything that might be dangerous to us. They're traditionally very hard to get to send a signal, which is good because we don't want to have a whole bunch of false alarms when it comes to danger. So these nerves, they buzz down here. Now I'm going along and I step on a nail. Ouch. Okay? That spiked all the way up to here. It sent a signal to the brain. Now the master controller of everything in my body is now alerted to the fact that I did something stupid. Okay, it's not altogether a rare occurrence, let me tell you. So, now, when we drop down, after we step on that nail, it drops down. But notice that it did not drop down right away, all the way back down to normal. It stayed high. Now, this is actually a good thing, right? Because when we have an injury, our brain needs to know more about what's going on in that injury to make sure it can protect it. Remember, pain is all about protecting you. Okay, it's a good thing, not a bad thing. Not pleasant, but it's a good thing. So when our body is protecting us through pain, it wants to know more about that area that's potentially at risk, that area that's has a danger, right? That poses a danger. So it's going to keep the nerves extra sensitive so they'll report more information to it more frequently. Okay, a lot of different analogies we could use to explain this, but we'll go ahead and move on. Now again, this is normal. This happens to everybody who has an injury, whether I step on a nail or I have arthritis or I have a back issue or whatever's going on. This is true of everybody. Remember, but in 1 in 4 cases, for some reason, that pain doesn't go away. And we have reasons that we think might be contributing in some cases, but we don't really always know why the pain doesn't go away exactly. Okay? There's a lot of statistical data that says that it correlates with certain kinds of life events, but we don't really know for sure, right? So a lot of it's guesswork, but it's the best guess we've got. However, as we demonstrate to our nervous system that the risk is low, that danger is abating, that it's kind of going away, we're good, we can do things safely, it starts to gradually go back down to normal. And that's what we want. See, over here we see this gradual return to normal. It's not a straight line, is it? Okay. Funny thing about our nervous system, right? It can go from 0 to 10 instantly, but it never goes from 10 to 0 that fast. Always gradually steps itself down. Now, let's go back to this. You see all this room for activity? Lots of room for activity. When our nerves are buzzing, those danger nerves are buzzing really low, we can run, we can walk fast, we can do exercise, we can wash dishes, mow yards, whatever we want. We've got all kinds of room for activity. It might create little bumps in that, but it doesn't spike it out enough to start sending signals, right? But after we hurt ourselves, after we've generated a potential threat, right, it doesn't go back down all the way to that very low state. It stays kind of high. Now look at there, that blue highlighted area, that doesn't give us a lot of room. Okay, now this distance between these two lines represents our tolerance for activity, right? How many people who have been hurt, say I stepped on a nail, twisted my ankle, whatever, my arthritis is flaring up, whatever the case may be, you don't really feel like doing a lot. right? I don't want to walk when I got a twisted ankle, right? And if my back is hurting, I don't want to stand up or whatever, right? Those kinds of things, that's your body telling you, hey, be careful, you know, just be careful. So in our effort to be careful, well, oftentimes we restrict ourselves. Our body doesn't tolerate the things as well after pain as it does before pain. And that's because that sensitivity is so high, right? It doesn't take as much to start getting that nerve to start sending signals. It takes it a while for the nerve system to calm down, even under normal circumstances, right? But especially if you fall into that unfortunate lucky 1 out of 4, right? It takes a lot longer. It can seem like it's never getting better, okay? The good news is, though, that since pain is more about sensitivity and potential danger, a threat, is whatever our system is detecting threat, right? This is actually really good news. Let me ask you this question. If pain was completely about damage and injury and illness and disease, somebody has an incurable disease, arthritis. We can't cure it. We can't make arthritis just go away. So if pain was all about disease, pain was all about just arthritis, does that person have any hope of relief?
Probably not.
No. But yet we have proven that people with arthritis can get relief through movement, exercise, medication, all these different things, right? So, when we get the nervous system to reduce its sense of threat associated with the different things that cause us pain, we can reduce that sensitivity. We can get that buzzing line to start going down to a normal level, which means we have now more tolerance for activity. Doesn't ever mean necessarily that we're 100% pain-free in all cases, but it means that we can do a lot more without the pain limiting us, right? So what kinds of things can we do about pain? Now, this is really the most important question, right? Nobody really cares about all the science unless you're a geek like me, right? What we really all care about is, what do I do about it, right? So, turn your thing over right here. I've given you a list of things that you can do about it, right? So, first thing, and this is a big one, don't be afraid of it. Fear paralyzes, it's what it does. Now, sometimes there's an appropriate thing to be, times and places to be afraid and let fear kind of motivate you to do some really wise things, right? Poisonous snake, I'm going to move away from the poisonous snake, right? That's a really good response to fear, okay? But letting fear paralyze you and not live life, that's not a good response, right? Now, there are a lot of people out there who are afraid to live life because of the pain that they experience. They're afraid of the pain, okay? And telling somebody to not be afraid of something is really hard. Like, I recognize that's really hard to do, but it's also really important. Sometimes it takes help. It takes help, it takes training to learn to not be afraid of something. But that's one of the biggest things that you can do, is to not be afraid to live life because of your pain, okay? The other thing is keep moving. The body requires movement to be healthy. One of the things that happens when people get in pain and that pain doesn't go away is they stop moving, and then of course what happens is they get less fit. Well, now they're so weak that they can't participate in life, and that doesn't make their pain better, it makes it worse. So you want to keep moving, but sometimes you have to pace it so it's tolerable. Okay, pacing means learning to recognize I can go this far and then I need to stop, give myself a chance to rest, recover a little bit, and then I go this far. So instead of vacuuming the room all in one day, you might take you 2 days to vacuum that room, or 3 days. Okay? Instead of washing the dishes all in one sitting, maybe we have to stop in the middle of washing the dishes and rest for a few minutes and pick it up and finish them later. You know? So be progressive, right? So that means I'm going to try to do more in the future than I'm doing now, but not all at once. Okay? It has to be in a gradual way, especially when we're in pain. If we try to do too much too soon, it flares up to pain, right? It's our body saying, hey, you're not being careful, right? I need you to be careful. There's one thing that we've learned from all of this research is if we respect our nervous system, it respects us back, right? So we have to be progressive, but in a gradual way. Okay, so slowly improving, increasing the things that we do on a daily basis. Okay. Be patient, recognizing it can take time to show improvement. Sometimes the people who find themselves out of these really complex, persistent pain states, okay, what they tell us is that I had to be patient. It took me years to get all the way out of it, but I had to give myself permission for it to take as long as it took. Okay? You have to focus on the things that you can do, not the things that you can't. Right? We know, right, that if we focus on something, it gets bigger in our mind. If we focus on our pain, it gets bigger in our mind. But if we focus on the things that we can do, that helps us to guide us out of that state. We want to set goals for ourselves to accomplish. Why am I even going to get up this morning? Right? We have to set goals. We have to set, you know what, I'm going to try to attain this level. I'm going to try to accomplish this task. But we also have to give ourselves permission to take as long as it takes to reach them, right? Sometimes we're so determined to reach that goal, we push ourselves too hard. Sleep. Sleep is an epidemic in the United States, right? People do not value sleep. But yet we know from lots of research that sleep deprivation negatively affects every single system of the body. Nothing goes unscathed from not getting sufficient sleep. And we know this even for people who say, oh, I do pretty well on just 4 to 6 hours of sleep, right? Well, statistics say, no, you don't. You may think you function well, but the long-term ramifications of sleep deprivation, of consistently getting less than 8 hours of sleep, has been well documented in scientific literature. It increases your risk for every kind of disease out there, just about, especially dementia, heart disease, diabetes, and chronic pain. Sleep. And you know, the last thing is sometimes the hardest thing to do, and that's recognize when you need help. Sometimes we don't have we don't have the capability of digging ourselves out of the hole that we find ourselves in by ourselves. We need to get a team of people surrounding us to encourage, to guide, to provide assistance and resources that we need in order to improve and get out of that. So those are the strategies that have been shown to be effective.